1 billion people across the world lack access to basic eye care treatments. And needless to say, this has a crushing impact on their life and overall productivity. In fact, in India alone, more than 30 million people are affected with low vision and blindness. Our today's change maker, Dr. Shroff's Charity Eye Hospital, has been working for the past 100 years to eradicate avoidable blindness. In the past decade itself, it has screened more than 4.6 million patients and conducted close to 300,000 sight and hearing restoring surgeries. So let's find out more.
Established in the year 1922, Dr. Shroff's Charity Eye Hospital (SCEH) was founded by Dr. Sorabji P. Shroff with the vision to eradicate avoidable blindness and the idea of giving quality eye care to all sections of society. Today, the Institute, without compromising on the core purpose, has evolved into one of the largest eye care institutions in the country with global recognition for its work in quality service delivery training, research and community work. The journey has not been without its challenges.
There was a phase, you can say, between end 60s to mid 90s when this hospital, which was working on a pure charity model, started to kind of degenerate. The services became, a little suboptimal. That was a time when a lot of new things were happening in ophthalmology with microscopic surgeries, lasers and things, and the place was not able to keep pace with it. In mid 90s, the Aisha group, especially with its chairperson, Mr. Vikram Lal, stepped in to support the hospital. They not only gave financial support, but also provided administrative support as well as visioning of the hospital. CEO in the beginning, Dr. Stephen Roy, who was a sports medicine doctor from US, a new vision was drawn for the hospital. And from a pure charity hospital, we became a cross-subsidy model. So this happened around 1999, 2000, when the hospital started focusing a lot on its quality of service. All the subspecialties within ophthalmology got developed, and the quality of patient care improved so that the patients who had kind of disappeared from this hospital for about 20-25 years chose to come here.
Today, the hospital network is spread across 7 locations over Uttar Pradesh, Uttarakhand and Rajasthan and is supported by 53 vision centers in the community.
So the way it runs is that 50% of the work that we do is completely free or highly subsidized for the not so fortunate patients. And we maintain our running expenses with the patients who can afford to pay. And patients choose to come here because today we are rated among the top 10 eye hospitals in the country. We have all the subspecialties of pediatric ophthalmology, retina, cornea service, glaucoma, oculoplasty, tumors of the eye, and also some rehabilitation services for which patients choose to come to us. And those who can afford to pay would pay for their service. And we continue to do more than 50% of our work free of cost. We take pride in the fact that we treat the penniless and also former presidents like Dr. Abdul Kalam, who underwent his cataract surgery in 2011.
As the Institute started its journey on the growth path, the human resource to fuel the growth became a challenge.
The healthcare of a particular region is as good as the human resource that is available. And so we do a lot of training as part of our service delivery. I think the next most important thing that we do is create human resource. So doctors, after their post-graduation, come to us to learn surgery, subspecialty. They serve in the community and provide service there. Of course, all of it is under supervision. We also train a lot of paramedics. And in the last 6 years, we have recruited more than 800 young women who have done 12th grade education from lower income families from in and around our surgical centers. that have been trained as vision technicians, ophthalmic nursing assistants, as counselors, as front office, and they've become largely the workforce on which we build our work. Almost 70% of the workforce is women. And we believe this whole program of having women in the system as paramedics not only brings efficiency and also better patient care in the system, but we are empowering women who otherwise didn't have opportunities in those areas. We're giving livelihood opportunities. And together, it actually almost 10 out of the 17 SDGs, the Sustainable Development Goals of United Nations, are being served through this. And eye care also has been recognized as one of the important things by WHO and the UN today, without which this SDGs will not be fulfilled.
A not-for-profit has many challenges, and one of them is sustainability. Dr. Shroff's has a unique cross-subsidy model.
It's a very interesting cross-subsidy model where we have patients who can afford to go to any of the boutique clinics come to you because you improve the quality of care to a level, or the skills that are available in this hospital people would choose to come to, and they would pay market rates for their procedure. Each of those patients who gets treated here is actually looking after some unfortunate patient who cannot afford this treatment. And so the patients who are paying for their surgery are actually looking after patients who are not able to afford treatment. So that is how the cross-subsidy model works. While for capital expenditure and expansion, we do need external support.
A key role in the journey and growth of Dr. Shroff has been played by its partners.
A number of international INGOs and the corporate social responsibilities of several organizations as well as individual philanthropes support us for this work that we do.
The organization has now embarked on an ambitious strategic plan.
We are aiming to do about 100,000 surgeries in the next 5 years. We want to open more surgical centers. We are looking at very interesting models where we are including doctors as part of our strategic plan. We create hospitals around them in areas of need. We are looking at 10 white papers, which we are seeing as important initiatives for the next 10 years, which includes building center of excellences, a center that will look at the more rare and difficult diseases called cured. We are looking at geographic expansion and the models for that. We are looking at how we are going to improve our partnerships and collaborations for research as well as service delivery, and improving our human resource and resource mobilization. So with all these initiatives, the future looks very promising. We have a very enthusiastic group of doctors, paramedics, the non-clinical staff, nurses. They're all very, enthusiastically participating in this whole journey. So we are very optimistic that going into the future, we are going to look at blindness eradication, which has been our mission for the last 100 years. We become more effective. We reach out to more people, and in the end, I think the society benefits from it.
With its enduring legacy, credibility and popularity garnered through word of mouth and individual references, SCEH attracts more than 2 million patients annually from across the country, and their workforce of 1,000 plus healthcare professionals are diligently working towards creating a difference in the society.